and good evening for different time zones. And welcome to the webinar for Healthy Buildings White Paper. And on behalf of GBPN and Ashok Bilal Architects, I welcome all of you. And over to Peter for the introductions. Thank you.
Well, thanks, Maz. Great. Well, welcome everybody. This is a really important project for the GBPN. Working on healthy buildings is fundamental to a just transition towards achieving sustainability. And as background, I actually have been just in a conference on the just transition, looking and presenting some of the outcomes of the work and some of the background to the work that we're going to hear about today from Ashok Bilal. And it was really quite striking that although there is a lot of work going on in energy justice and environmental justice, that the rights of people to live in adequate housing and climate adequate housing wasn't really on the radar. It was much more about the impact of environmental pollution on people. But fundamentally, where we live and where we work is perhaps the most important habitat for us. And so understanding how buildings perform and the ways in which buildings should perform to protect our health and well-being, whilst also reducing the risks of our health and well-being posed by climate change, are perhaps among the most important issues we can tackle in the built environment. So a quick introduction to me. My name is Peter Graham. I'm the Executive Director of the Global Buildings Performance Network. I'm also an Associate Professor at Monash University in Architecture, and Monash University is the global research partner in this process as well. The Global Building Performance Network's been it's established more than a decade ago to support government and industry to work together to decarbonise the built environment and make sure that the building sector plays its role in avoiding the worst case scenarios of climate change and achieving the Paris Agreement goals. And in India, actually, we've been working on and off since around about 2013, 2014 on these issues, particularly focused originally on understanding more about how housing uses energy, how people in homes use energy, and establishing some scenarios for ways in which the building sector needed to rapidly regulate, particularly housing energy performance. And so some of that work contributed in some ways to the regulatory changes, the ENS framework that is in place today. But I think when we look at the performance of buildings, we can't just look at energy. We have to look at we can't look at energy in a quantitative way. We have to look at it in terms of its service. And I think where we started to get concerned about even energy efficient buildings not being comfortable is where this project was born. Trying to understand the pressure of people living particularly in affordable housing to provide just basic thermal comfort so they can get on with their days. The background to this project is that we started, we also, I should say, wanted to think of other ways of accelerating regulatory reform so that we could more ambitiously get towards zero emission and net zero energy homes. And clearly, pushing forward with work on climate policy and energy policy is important, but particularly coming out of the pandemic, the awareness of public health became a major priority for public policy. And of course, the way people maintain health, the way they use energy to do that also has an impact on climate and energy costs. So we started to look at the evidence base with Monash University on the link between housing performance, general health and well-being, and also the link more specifically between thermal comfort and health. And the global evidence is pretty strong. There's a number of very good published reviews that demonstrate that there is certainly a strong link between the way buildings are designed and operated and the thermal comfort of people, and the link between the thermal comfort or the thermal discomfort of people and a number of fairly severe health impacts, including increased rates of diabetes, increased rates of heart conditions. And what we've seen in some of the work that was conducted in the first phase of this project with Ashok Bilal architects around things like seasonal domestic violence and the real impact that it's having on women and families in particular. So we're here today. So that's a bit of background to the GBPN. We also work. We are a global network. We call ourselves a global network of local experts. And the idea behind the way we organise is that when we see issues that need support with respect to policy reform, we have local trusted experts in place who we can support to work on change. And the role of Ashok Bilal and his team is a great example of that. So we want to talk today about the outcomes of the phase one work that ABLA have been leading, which has led to the development of a white paper, which defines healthy buildings for the Indian context, and also looks at how these sorts of guidelines need to be incorporated into the rules and regulations that govern the design and construction of affordable housing in India. So this white paper is going to be submitted to the Bureau of Indian Standards for inclusion in changes to the residential code for affordable housing, which is really exciting, because it means that if you think about the volume of affordable housing being constructed in India right now, to be able to make changes to regulations that would affect all affordable housing in India is really important. And if you think about the billions of people who that's going to influence over time, it highlights the importance of the project. We are really happy and very honoured to have ABLA involved in this project and leading the project. And I think the trust and the status of the work that Ashok, you've done, and the team over the years has given the outcomes of this project more gravitas, and the outcomes and guidance that's included in the white paper a lot more trust. We also have in the project, I mentioned Monash University, which has been involved originally in developing the evidence base, and then supporting the management of phase one, and now as a global research partner in phase two. There's some interesting opportunities we're exploring with Monash University around bringing in their School of Medicine and Nursing, Public Health, to look more at the epidemiology of building performance. And we also have, as a really core partner on the health side in India, the Indian Institute of Public Health. And the IIPH are a consortium of partners on this project and are bringing that local experience again of what are the health impacts of communities, particularly experiencing the kind of impacts of climate change we see now, looking at also measures for being able to improve resilience and guard against the kind of, I guess you could almost call it a heat pandemic that we're seeing now across the world with regards to not just increased global temperatures. And by the way, the 5th of July, it's worth noting, was the hottest day ever recorded by humans on planet Earth. So just let that sink in for a second. It just shows you how important it is that we understand that we are in an emergency situation, that there are significant health risks. And so it's really good to have the experience of IIPH on the team. The other aspect of the project I think is worthy to note is that we've had great support from our review committee members, and This are a group of industry partners, industry experts, and other partners who have got expertise in the fields of health, sustainability, and the affordable housing sector. And it's been important to have that stakeholder review of the drafts of the recommendations in the white paper, so that we can see that there is a broad range of voices which have come together to support what's going to be presented today. So with that, I thank you all for joining the webinar, and thank you to Mars and the GBPN team for steering us through these projects, and would love to now welcome Ashok Bilal and his team to take the floor.
Hello. I'm Ashok Lal, an architect practicing here in India, and really delighted to be part of the GBPN projects concerned particularly with affordable housing in India, and the notion of bringing in the notion of the broader scope of what is meant by healthy buildings into the frame, and at the same time seeing how we can look at current policies and provisions and techniques of design to move towards a situation where we can both adapt to the changing circumstances due to climate change, and also in the same process help mitigate the effects of climate change. The sociological aspects of this whole project are extremely important, and that is why the focus on affordable housing is selected really as something that we should be pursuing. Program in India is also growing quite rapidly. I am supported here by my colleague Girisha Sethi, and the two of us will try and stitch together our presentation, taking turns. And so I'm asking Girisha to just bring forward the first slide, and then we move on from there. So what we, as Rem just said, this is about how we came to write a white paper concerning affordable, healthy buildings in India. These are the participants in the group that have worked on this project. Of course, it's the Global Buildings Performance Network, who are the funding agency. We have Monash University as the international research partner. Then it's my firm, Ashok Bilal Architects, who implement the work. And we also have Indian Institute of Public Health, who bring in this very important dimension of public health into the realm of design for housing. So this is the project team that is undertaking this work. We have a presentation that is divided into 3 sessions. We will start with an introduction, broadly to give you the background of the situation in India and how the white paper then seeks to respond to it. Then we have session 2, which goes into some depth about what we've discovered through our research in defining healthy buildings or healthy homes, and understanding the notions of health, and also those aspects of climate change which call for design of healthy neighborhoods and the construction of buildings in response to that. And at the end, we have a 3rd session, which just goes into the recommendations that we have prepared. It's a kind of a summary of recommendations that we prepared that are addressed to various organs of government, through which we feel the change in the implementation of policies, or change in policies and the implementation of rules and regulations can proceed. That's the 3rd session. In each of these sessions, we will have a pause between them when we shall ask a few simple questions to which you will respond. So please take your notes. This is just to see whether we've been able to communicate what we wanted to do to you, and also to see whether you completely or not so completely or totally agree or disagree with us in what we are saying. So these are very important polls which happen at the end of each session. And at the end, we will have a question and answer time too. Next. Well, we are in the process of very rapid urbanization in India and a huge demand for affordable housing, particularly in cities now. And it is projected that by 2050, half of us are going to be living in cities. But in fact, those who are even more informed about the trends today are saying it might come sooner. So this is happening very quickly. As you can see, there are some numbers here from 2018 to 2050, right? These are numbers that tell us that we will have added 416 million urban dwellers. And this puts a huge demand on affordable housing. You can just see the scale of this. And the shortage continues to also grow and create pressures, because the rate at which people are coming into the cities, many of them with poor resources, is not being met by adequate provision of housing. And so you have the specter of ever-growing slums as cities grow. And as you can see, the last statement here shows very clearly that most of what we call the shortage in housing is in the area of the economically weaker sections of the city population and the lower income groups of the city population. Next. So far, government, of course, has been quite concerned about this, and they have really said that, we must find ways of giving everybody an adequate home, how small, no matter how small it is. And they have got schemes that provide a little bit of subsidy in order to enable people to get themselves a home. But the pursuit has been purely, if I may say so, purely quantitative. Numbers is what counts. But in the process of just providing numbers, are we missing out on what quality of homes we are providing? Especially as you look at the fact that whatever gets built today will last for 50, 60 years. And so what you build today with great rapidity should not drive us into some trap, which is not the appropriate environmental condition, and also had negative environmental impact in the way it's built. So we need to be very careful about that. And we need to be able to use whatever resources we have with great care to achieve a qualitatively improved result, not only the quantity. Now, research has shown that the average temperature in India, in many, many parts of the country, is expected to rise very sharply, as you can see, if things go on the way they are going. And of course, this has been said many times over, but it's worth repeating, that poor populations of the global south are the ones that will be affected most by the stress and disruption caused by climate change. Therefore, affordable housing is our focus. And we've also seen that even while affordable housing is now picking up in the country, we do notice that designers are not really up to looking at passive design strategies that can counter the effects of climate change, rising temperatures, and provide the required amount of comfort. And this, let's say, blinkered way of designing without recognizing the potential of passive design might lead to greater discomfort as temperatures rise. And just one little word about temperature rise, that even if you're talking about average rise in temperature, when you go into the heart of cities, it rises more sharply because of the urban heat island effect, which compounds it. So this aspect of design becomes extremely important. Next. Well, we're also getting what we call heat waves. short periods of time where the temperature rises sharply. And this is then accentuated by the urban heat island effect in the cities. Of course, this leads to health hazards. And then if you can afford it, you can afford air conditioning and artificial means of making you comfortable again, it'll lead to demand for much greater amount of energy, with fans and air conditioners, etc., being pressed into service. And that, of course, then goes against climate change mitigation, because it leads to greater GHG emissions, because most of the power, up to 70% of our power, even now today, is from carbon-based sources. In the case of affordable housing in India, the short-term energy demand is actually limited, because if I can't afford an air conditioner now, I'm not going to be using it, right? And therefore, I might suffer the discomfort that is coming my way, unless the buildings are really well designed. But even then, I'll have to suffer the discomfort that's coming my way. But in time to come, maybe in 5 years' time or 10 years' time, as I stabilize and my incomes improves, I will begin to look for the air conditioner and install it, because life is getting unbearable. So there is a latent demand for energy consumption in the affordable housing sector, which is a huge sector. And that is why today passive design becomes extremely important as a way of making energy efficient design of buildings. Using this approach reduces the latent demand for energy that will come up when people's incomes do improve. Next. Well, our friends from IIPH, Indian Institute of Public Health, Gandhinagar, have done a lot of work in this area, looking at the effect of climate change on the health and well-being of people in cities. Their work has been focused generally around Gujarat. But now we know that a lot of work is done from home. As you can see, 42 million home-based workers are working from home, and most of them are women. Okay, so you get a double blow. Your productivity, your conditions of work suffer because of the heat waves or during the heat waves. And so your health and productivity also begins to suffer. And a large number of people are involved in that, and many of them women working from home. And we're talking about the quality of the home. Moreover, the trend in affordable housing is towards now, surprisingly or not so surprisingly, I don't know, going towards higher and higher buildings and higher densities in cities. The homes are small because that's all you can afford, 30 to 50 square meters. But the households are large. So you get very high densities. And these high densities into sort of high, let's say high intensity development in cities, bringing a lot of people together, is beginning to lead to social and psychological stresses. And these are mostly felt by the women and young girls. This is something that we discovered as we went and interviewed and had focus group discussions with people in some of the housing estates that have already been built. And, there's a loss of privacy. There's a threat to safety of women if you don't design that carefully. And there's a feeling, if you're in the upper floors, of alienation and confinement, especially for the elderly who are not so mobile, can't use the lift, sometimes the lift is not working, and for children who can't be trusted to just run down 10 stories and play outside and come back safe. So this is a real issue. Next. So what does this white paper try to do? It tries to look at the center of this Venn diagram. It says we have the issues of climate change, and through the process of developing affordable housing, adapt to it, as well as while building, reduce emissions in the process of construction and in the process of operating the buildings in the future. We also have to find solutions that are affordable with not much resource, affordable for the lower income groups of the cities. And we do need to look at health and well-being, particularly from the perspective of women and girls, a gender perspective. And so when we can find those sets of recommendations that can kind of meet all the three factors together, that is what this white paper has attempted to do. Next. So, Girisha, am I supposed to hand it over to you now?
Yeah, sure. Can you hear me well?
Yes, take us forward, Girisha.
I'm sorry, I think my internet is a little unstable. Okay, thank you for establishing the context of the research. Building on the concerns addressed so far vis-a-vis climate change, affordable housing, and health and well-being for low-income groups, the white paper tries to establish a holistic definition of health and well-being appropriate for affordable housing in India. The largest scope and objectives of the white paper cover: one, the definition of healthy buildings, taking into consideration the physical, social, and psychological health of lower income groups. Two, it proposes mitigation and adaptation strategies that co-benefit the health of the inhabitants, especially with focus on the design of the homes and the neighborhoods for affordable housing. It focuses on special taking into care the needs of women, the elderly, and the sick, as well as children, looking into secure social interaction for these groups of users. And finally, the white paper lays forward recommendations for upgrading building policies, codes, regulations, along with proposing an institutional and regulatory framework for coordinating the proposal put forward. Before jumping into the white paper, it helped us to recognize what are existing national initiatives that already work towards promoting climate responsive, healthy habitats in the Indian context. So the National Mission for Sustainable Habitat is already an initiative that complements the scope and the objective of this project. The Bureau of Energy Efficiency put forward the Eco-Niwas Samhita, which includes design guidelines for energy efficiency of multi-story residential buildings. So that is another scope for alignment of our efforts. The heat action plans proposed across the country's commitments to the Sustainable Development Goals, its nationally determined contribution to reduce its greenhouse gas emissions, and the affordable housing finance. These are some of the initiatives that already move initiatives in the direction that the Healthy Affordable Housing Project attempts to do, and offer scope for complementing, coordinating, and supplementing the efforts we're trying to make in this project. With that, we jump into the methodology that led us to the formulation of the white paper in the phase 1 of the project. The project started with trying to define healthy, affordable homes in the Indian context. It involved desk research, expert engagement to build an understanding of what really healthy homes mean when it comes to residential buildings in India. Secondly, the project then identified existing opportunities in the policy and program frameworks at place to look for alignments, to look for gaps, to look for scope for proposing guidelines for improving the health and well-being of inhabitants in lower income housing groups. Thirdly, the project involved a pilot study, a living lab, including performance analysis, surveys, and charrettes with real projects in Gujarat. The process involved on-site measurements and focus group discussion to see what are the needs felt by the inhabitants in these projects, what is the building performance of the existing design and construction of these projects, and how one can incorporate the recommendations coming out of this project in those projects as a demonstration project. Finally, the recommendations were put together in the form of the white paper that we discussed today, which includes recommendations for various institutions and organs of the government, including the National Building Code, model building bylaws, the development control regulation, as well as green building rating systems that work in the purview of affordable housing in India. This brings us to the end of session 1. I'd request Mars to share the link to the survey in the chat. At this point, we hope to receive your feedback on what you think about, one, how the design and construction of healthy homes can or cannot contribute to climate change adaptation and mitigation. 2, if you agree that affordable housing should prioritize measures to address the needs for privacy and safety for women specifically. And 3rd, if you agree that high-rise and high-density housing add to increased social and psychological stress in the occupants. Let's take a couple of minutes to answer this before we proceed to the session 2.
Yeah, Girisha, I think we can move ahead.
Okay, coming back to session 2. Here we want to discuss how we went about defining healthy homes in the Indian context and laying out the framework on which the recommendations are based on. So the process started with looking at literature, international sources on how health is being perceived and looked at in the context of the built environment. So different researchers, different institutes had different way of perceiving the idea of health in the built environment. Many of the concerns that were highlighted in literature were focusing on artificially controlled indoor environments in a developed context, things like sick building syndrome, indoor air quality, active cooling, also touching upon heat waves and other such threats coming our way with climate change. But one realized through literature that there is a certain lack of theoretical framework in the context of developing countries in India to define healthy buildings, especially when most of the buildings, including residential buildings for lower income groups, are not closed, artificially conditioned built environments. So in that context, the challenge was to adapt international frameworks and international proposals to the living conditions of the Indian context, taking forward the framework for health laid by WHO. In the process, we proposed that a holistic definition of healthy, affordable homes in the Indian context should look at physical health of the inhabitants, how the built environment and the design and ease of the environment promotes comfort and physical well-being. Number 2, social health, how the design of the built space, the neighborhood promotes social interaction and social well-being for the inhabitants, the community at large, including different groups like children, women, elderly, the sick, Number three, looking at psychological health of the individuals, the occupants of the healthy homes, how the design of the dwelling, the design of the building, the design of the neighborhood at large affects the mental comfort and sense of security of inhabitants. And number four, looking at the resilience against climate change and other extreme events like pandemics, and how the built environment can provide health and well-being by building that kind of resilience. Taking the four major indicators for or determinants of health and well-being in the context of affordable housing, we developed specific indicators for the design and construction of not just the individual home, but also the building, the overall residential community, and the neighborhood of affordable housing, where these indicators can help address physical, social, psychological health and resilience. So a set of parameters or indicators were developed to see how they can be incorporated in the design of the affordable housing. For each of the four determinants, the indicators were developed in a way that they can be incorporated in the process of designing and constructing affordable housing. For example, for physical health, we propose that to enable thermal comfort for the inhabitants, the design of the building should integrate climate responsive passive design strategies and low energy devices to maximize indoor thermal comfort. To improve visual comfort, we propose that the available diffuse daylight should be optimized during different times of the year in all habitable space, and it should be possible to modulate that with external shading systems. To help protect the inhabitants from diseases, from pollution, from threats of infections, we propose there should be proper drainage of all external surfaces to avoid waterlogging and to inhibit the formation of bacteria and larvae. In that sense, the housing should also be protected from mosquitoes with netting to create a healthy environment in that sense. We propose good ventilation in all indoor spaces and measures to avoid dampness and flush out humidity to improve thermal comfort. We propose that the residential neighborhood should have a distance and segregation from heavy traffic arteries to minimize the intrusion of air pollution, and likewise minimize the intrusion of noise pollution and protect them from loud noises and other sources of noise besides the traffic. In terms of social health, we propose that healthy buildings and neighborhoods should promote social interaction and social cohesion of the communities living there, opportunities for people to interact with one another and not be limited to the small dwelling units. And in that sense, the shared spaces and common areas should be designed to promote that kind of an exchange. We propose there should be space for recreation of children and youth so that they don't feel alienated or bound to their dwelling units. And likewise, there should be sheltered, covered spaces for group activities as well. We propose there should be convenient access to community health and resilience centers. So not only spaces for the community to come together, but spaces that help provide resilience against extreme events and are equipped for protection and care for the vulnerable residents during disruptions. We propose that the needs and concerns of women should be met with priority in terms of their need for hygiene, access to healthcare, and workspace, as many of them are home-based workers. Likewise, women should also be included as equal stakeholders in the operation, management, and maintenance of the community assets of the neighborhood and the residential complex. And finally, there should be a standard proposed in the codes for minimum space per person within the buildings and in the shared open spaces to avoid overcrowding and to avoid that kind of congestion in the open spaces shared by the community. In terms of psychological health, we propose that healthy buildings and neighborhoods should limit occupant density within the dwelling to avoid overcrowding and provide means for occupants to balance their need for interaction with their need for privacy as per their preferences. They should not have to compromise one for the other. Secondly, we propose that positive green spaces and other kinds of open spaces like terraces, balconies should be provided so that the inhabitants have contact and interaction with nature. Thirdly, we propose that the design of the dwellings and the structural system, the indoor spaces, should have elements of flexibility as per the family size, as per the needs of the family, so that psychologically they don't feel constrained to the proposed structure and can exercise some flexibility and choice in the design and the usage of their homes and dwellings. Lastly, when we talk about resilience against climate change and pandemic, we propose that healthy buildings and neighborhoods should have additional support infrastructure and facilities, both in the design and the usage of the space as measures of resilience during periods of extreme events. The habitable spaces and important services of the community should be protected from disasters like flooding or contamination during extreme rainfall and flooding. And likewise, there should be a reserve of extra store of water for the community during periods of drought or other kinds of extreme event as a backup that belongs to the community at large. With that, we come to the end of session 2, having discussed the broad guidelines and proposals for healthy buildings at a physical, social, psychological, and resilience-based level. In the chat, there is a link to the survey for session 2, which hopes to receive your input on what you think about incorporating passive design strategies for climate response and how that can improve the physical health of occupants. Asking if you agree that healthy, affordable homes should include measures for social and psychological well-being of occupants. 3, if you agree that for social and psychological health, there is a need to limit the population density in affordable housing. And 4, if you agree that healthy, affordable homes should have additional support facilities to ensure resilience during extreme events and epidemics.
I think we can go ahead, Krish.
Okay, I hope everybody's managed to fill in the survey. I'll hand over to Ashok sir to take us through the first part of the last session of the webinar.
Thanks, Kirisha. Well, here's a kind of a summarizing map of the entire activity. Okay, I've been asked to start my video, and here I am. So this is a chart that kind of summarizes the total activity leading to the white paper. On the left, you see that we have that broad definition of healthy buildings. And then there are the indicators of different kinds of health, whether it is physical, social, psychological. And then the idea of resilience against climate change. You have those indicators. And these indicators are then translated in terms of what the building design ought to do. And there's a whole list of what the building design ought to do. You get a long list. And then from this list, you refer back to the instruments of governance that will affect the, the progressive design of affordable housing. So it's the national policies, there are codes and programs. It is the regulations at the state and the urban local body level. And it is also the green building rating systems, which do a kind of a pre-certification or approval of projects, large-scale projects by governmental agencies. And you can see how these strings have to be put together to refer, so they kind of summarize in each of these boxes at the right-hand side, what would be the appropriate recommendations that concern them particularly. So this is a broad summary of how we've gone about the whole work. Now it's very important, since government is hierarchical. So you have something at the top, which is the policies. And then this then leads to programs, which the government initiates. Then you have regulations which are managed at the state level. There are several states in India, and at the level of the urban local body. That happens at the next level. And then this is on the margin, so to speak, supporting this whole activity is also the green buildings rating system. Now, it is important that each of these levels are consistent one with the other. They should not contradict each other. They should be harmonized with each other. So that is one of the things that we consider to be an extremely important aspect of any policy shift or program shift in the implementation of things like this one. Unless you have harmonizing activity at all levels and in the various instruments of governmental action, you will run into some roadblock or the other. At the top of it is the National Urban Housing and Habitat Policy on the one side, and you have the National Health Policy on the other side. And one of our great learnings from this project, working together with the IIPH, the Indian Institute of Public Health, Gandhinagar, was that in their work, especially related to climate change, now they're beginning to make demands of town planning and building regulations from their side, because they now recognize that there's a correlation between, health, comfort, the effect of heat waves, and all the stresses that developed out of it. And this is a correlation between that and buildings and the built environment. So when they saw that, they start making demands on the building side of governance. And so at the top, we say that the National Urban Habitat and Housing Policy should recognize the demands of the National Health Policy. And the National Health Policy should, in turn, include the Urban Habitat and Housing Policy as an aspect of their policy also. So that's very important, right at the very top. Then you have the National Building Code and what I call the building bylaws, the model building bylaws. Both of these are national level documents, and they need to incorporate aspects of health and well-being, as well as resilience to climate change, and begin to institute mandatory provisions to be then executed by the ULBs. So this is the instrument of the central government, which then passes on to the state government, and the state government then passes it on to the urban local bodies. But so this actually is the strategic level of change, which then goes down the scales to local levels. And you have programs like the Prime Minister's Awas Yojana, PMAY, which is a flagship mission for housing. So some of the requirements that come from the NBC and the MBBL need also to become prerequisites in the support being offered to prospective house owners under PMAY. Then the program becomes consistent with our regulations also. And so the paper strongly recommends that the minimum standards for PMAY bring all forms of group housing under an upgraded NBC and MBBL, which would dedicate a special section to affordable housing. Now, this is a shift within the National Building Code that we are talking about, because National Building Code had so far really talked about low-cost housing. But when you expand that notion to affordable housing, especially when it talks of the addressing the urban demand, you now have to look at it as a sizable chunk that must be part of the NBC, including, of course, the objectives of health and well-being in the context of climate change. So this idea of harmonizing the guidelines across the structures of governance and instruments of policy is extremely important. And here, are you taking over, Girisha?
You can explain this. I'll take
I'll
over
explain this.
after
All right.
you talk about the institutional framework. Yeah.
So if you look at how instructions and power flow from the central government, eventually, central government in the pink box on the left-hand side, to the local building bylaws at the bottom on the right-hand side, you can see how instructions and policies flow from one to the other. And within this set of arrows going from one side to the other side, we then decided that we will focus on these ones. And our primary audience, so to speak, is the National Building Code and the Model Building Bylaws. First, the National Building Code, then the Modern Building Bylaws adjusted according to the National Building Code, and then a harmonizing between the National Urban Housing and Habitat Policy and the National Health Policy. And we think that if we get this right, other things can then be picked up and we can follow up on it, or they will follow the right course in due time. Next. And so the roadmap is really, as I just said, that we first look at the enhancement and coordination between the National Housing Policy and the National Health Policy. Then we look at the National Building Code. And the National Building Code is actually formulated through the Bureau of Indian Standards. And the Bureau of Indian Standards conducts a process of consultation with different committees to review the National Building Code from time to time. This review is now imminent. We have got our foot in the door at the right time. They have been very welcoming to us, saying that, yes, this is the right time for us to rethink. And of course, affordable housing as well as climate change are extremely important subjects for us. So we'll be working with with the Bureau of Indian Standards to help in the revision of the National Building Codes, which is going to happen over the next year or so. Then this will lead to the building bylaws, the model building bylaws. And then also, finally, this is a different, let's say, different direction a little bit, because it's not only the buildings themselves or the construction of the building itself that is our scope. Our scope is also the collection of buildings that form the urban environment or the housing neighborhood. And these are affected by regional development plans and the formulation of some of the guidelines provided by the for urban development. So that will be the next thing that we will have to approach, because that will again also then filter down to local town planning regulations and development controls that affect eventually the quality of the urban neighborhoods.
I'll
Now,
take over from
now
here.
it's for you. Yeah, Girisha.
Okay. Coming to the last segment of our presentation, putting the layers together of the framework of health with its 4 determinants: physical, social, psychological, and resilience, and proposing them for the selected instruments of governance as identified and highlighted by Ashok sir. We put together recommendations specific for the built environment, for the National Building Code, for building bylaws, for development control regulations, and green building systems. Starting with the National Building Code, we propose that for physical health and resilience at the same time, with certain recommendations co-benefiting the 2 determinants, we propose an adherence to the Eco-Niwas Samhita put in place. For the thermal comfort of inhabitants, we propose it should be made prescriptive and mandated in the sense to give standard solutions for thermal comfort with design proposals for walls, windows, shading, roofing, and other aspects of the building for ease of implementation in affordable housing projects. We propose provisions for mechanically aided ventilation, again, to improve thermal comfort, mandating roof constructions with reflective coating and high insulation, roof-mounted solar PV with its double benefits of providing clean energy, and also providing resilience as a measure of cool roof for the building, protection of homes from mosquitoes, proposal for proper drainage to avoid stagnant water that may create infections in the neighborhood, providing provisions for minimum buffer of land between the housing complex and major transport arteries to minimize both air and noise pollution. And finally, provisions for resilience in terms of emergency water storage and sheltered resilience centers in every affordable housing project. To talk about social and psychological health and the measures providing resilience as well, we propose that the National Building Code should have provisions for minimum standards of accessible shared space for the community. These can be sheltered or open, but adjacent to the homes, the small homes of low-income groups, as a compensation for the really small dwelling units with always really high occupancy in each of them. We also propose that the FAR incentives should be prohibited, and the FAR should be limited because it can contradict social and cultural appropriateness as well as environmental sustainability of the building complexes. We propose women should be included in post-occupancy management of the community assets in the community spaces of the building complex. The building heights of affordable housing should be limited to stilt plus 4 stories as a fundamental requirement to promote affordability, environmental sustainability, low carbon footprint, and better cultural appropriateness of these buildings in terms of how the community can use the space. We also propose that the dwelling densities, the dwelling units per land, should be limited to avoid overcrowding so that there's not a lot of dwellings sharing a small piece of land and a small set of shared spaces. There should also be limit on hard paving and vehicular access in the area to increase green and soft ground. The provisions for vehicular parking and access to green spaces should be reviewed in a way that we can maximize the green spaces in the complex. Similarly, the fire tender should also be reviewed in a way that the green spaces can be optimized and maximized. And finally, we propose that there should be design provisions to permit flexibility in the partitioning of indoor spaces of dwellings to allow that kind of flexibility and choice to the inhabitants. The similar kind of recommendations flow and trickle down hierarchically to the model building bylaws, to the local regulations. So likewise, we have a similar set of proposal for provision for modern building bylaws at the national level, which would inform the building bylaws at the state level. So we have a set of recommendations for physical health, likewise for social and psychological health. as the development control regulations have a say in certain aspects, especially the quantitative aspects of building design, we propose that for physical health, they should include provisions for minimum buffer and protection against flooding. And similarly, for social and psychological health, there should be provisions to limit building heights, limit the densities, to limit the hard paving and parking, and also the fire tenders. So the quantitative aspect should also be reviewed, and certain limitations should be put to allow more healthy spaces in the building complex. Finally, we identify a few green rating systems like GRIHA, the Indian Green Building Council, IGBC, and EDGE that work in the purview of affordable housing in India. And they could include certain recommendations and provisions in their certification system, both for physical and social psychological health. So similarly, we propose that there should be prescriptions for cross ventilation and external shading, also how the building responds to the orientation. There should be provisions for habitable outdoor spaces outside the dwelling units, waste management, drainage, water storage, resilience centers, and protection from disruptions. In terms of social space, again, we propose that the rating system should look at provisions of social spaces as well in the certification, for community facilities in the building complex, how the complex responds to home-based income generation activities as another point in the certification, and in terms of adaptability and flexibility, how the buildings responds in its internal space to provide better choice and flexibility to the inhabitants. That brings us to the last part, where taking forward what we already have, we propose that the next steps in our project is to translate these guidelines and recommendations into technical clauses. So from the roadmap that we talked about, we are going to focus on the first 3 steps, how the National Urban Habitat and Housing Policy and the National Health Policy can be enhanced in a coordinated manner with specific focus on the challenges posed by climate change. We are working on translating the guidelines for the National Building Codes, which right now are in the form of action for design and construction, into specific technical clauses that can become a part of the anticipated revision of the National Building Code. And with that, we would want to request the Bureau of Indian Standards to consider those in the awaited review, particularly for the section of low-cost housing and responses and approaches for sustainability. At this point, we would request your feedback to improve the current status quo of the white paper and expand it before we can finalize and publish it. And in the coming phase of the project, we intend to test the feasibility of the proposal we've put forward in the white paper by working closely with 2 affordable housing projects, where these recommendations can be demonstrated and integrated in the process in a way that the learning from that kind of engagement will inform and help improve the white paper. That brings us to the end of the presentation, also the end of session 3. I request Mars to share the link to the last survey poll for session 3, where we request you to share your opinion on how you feel about the coordination between the habitat policy and the health policy. Do you agree it is necessary in light of climate change? 2, if you agree that the development control regulations need to review provisions for vehicular access and parking in a way that the hard surfaces are minimized and the soft and green covers are maximized. 3, if you agree that building heights need to be restricted, that's a sensitive one, to respond to affordability, environmental sustainability, and social psychological well-being. And finally, if you agree that even the green rating system as well should address that aspects of climate change resilience and social psychological well-being of inhabitants are incorporated with focus on affordable housing.
Yeah, thank you, Girish. I just want to add a couple of thoughts to what you presented. One is that the listing of our recommendations bring out recommendations which are not yet incorporated in any of the present regulations or codes. So these are things that would have to be looked at additionally over and above what already exists. So it's really, in a sense, it presumes that many people in the audience already know, they're familiar with the National Building Code, they're familiar with the rating systems, they're familiar with PMAY, and they're familiar with the policies. So what we are bringing out here is stuff that is new considerations, additional considerations over and above what already exists. Yeah. And the other point I think is since we're asking for people's comments on the white paper has been produced in the form of a text, which all these slides kind of summarize for us. But that text is also there, and maybe it depends on GBPN how they want to make this text also accessible for commentary.
Well, thanks, Ashok. This is obviously a very comprehensive platform that's been created now. And I think that the process that's being outlined in terms of the policy levers, how to bring this forward through the policy and regulatory processes is really key. The question of how to make this text available and reviewable, I think on the one hand, as we're promoting this through the webinars today, it's very important that as many stakeholders as possible can learn from the work thus far developed. And the particular layout of the white paper at the moment will need to be prepared for public review. And I think that there's no reason, I can't see a reason why we couldn't disseminate this widely. I know that there's definitely interest in other countries in what's been achieved here so far, in Indonesia in particular, where we're working currently on the national policy reform pathways to achieve zero emissions buildings. We definitely need to include these sorts of aspects in that work. So I do think that, in general, these principles should be widely disseminated. In terms of how best to increase the awareness of these and build support for these in India, I think I'd take your advice on that. Whether we are, and I'd love to hear from people on the webinar too. I mean, I hope this has been a very useful introduction to the framework. More of these, more targeted audiences could also be a good point of view. But yeah, we'll support what's going to be most effective in making sure that these are eventually incorporated into the regulations, Ashok. So
yeah,
I'm happy to support that process.
All right. Yeah, great. Thank you. So I think Maz, you'll take over for questions and answers.
Yeah. So anyone having questions so far can post it in the chat box and I'll read it out for you to Ashok sir. And meanwhile, we also have a representative from BIS, Mr. Dheeraj. So we would request your feedback on today's seminar and any inputs for the white paper so far. Hello.
Do you have his phone number?
Unfortunately, no, sir.
I also don't have it right here.
Yeah. I think he's trying to talk. He unmuted himself.
Right.
Yeah.
Dheeraj, we are waiting to hear from you.
Yeah, so we have a question while he's setting the computer up. We have a question from Philip Jose. Are you going to share the white paper? So I think I can answer that, sir. With your permission, as Peter mentioned, that we'll be sharing it in some form or the other and on the GBPN website. So you'll be hearing back from us regarding the details of the white paper soon. Yeah. Anyone has any questions, they can post in the chat box. Okay. Yeah, we have a few questions coming in, sir. Do you want to wait for Dheeraj or should I ask one or two of them?
I think you'll proceed.
Okay.
Yeah.
Yeah, so we have one from Purnima Iyer. I wanted to share that apart from daylighting, ventilation, we could also be looking at artificial lighting.
Yeah, artificial lighting is in the National Building Code is now being provided as standards for different spaces. And as you know, there has been a popular shift towards LED lighting sources, even in the residential sector. And because of some of the initiatives taken through certain governmental programs, LED bulbs have also become reasonably affordable, and people are now putting in LED lighting systems. So I don't think it needs to be taken up as a separate issue. This is already a part of policy and supported by the National Building Code quite adequately. But that does lead me to one other thought which I should share with you. That is that there are electrical appliances that are being used in affordable housing, like exhaust fans. Of course, you have the cooking appliances there too, but ceiling fans. At the moment, the system is that if you're a developer, whether you're a governmental agency who are developing housing or a private developer developing housing, you leave the equipment for fans and light fittings and so on for the occupant to put up at their own expense, right? That's what you do. So people just bring whatever they have or they buy whatever is cheapest in the market and they put it up. This is a real lost opportunity. What is possible is now using a similar principle of bulk purchase, bulk sourcing for affordable housing through some mechanism, as has been used for light bulbs, same kind of principle you use for fans, whether it is ceiling fans or exhaust fans. So you can now buy energy efficient ceiling fans that will consume, say, 28 to 30 watts, as compared to the less efficient ones, which are still in the market, which consume 50 to 60 watts. So you can halve the fan consumption if you choose the right kind of fan. But if you have a bulk purchase and supply program tied to affordable housing, you will make it affordable. So there's a big opportunity just here. So thank you for that little prompt, but it's led us to an interesting idea.
Yeah. We'll try Dheeraj one more time, if you can.
Hello, can you hear me?
Yeah, we can hear you perfectly.
Yes,
Very
Dheeraj.
good. So we at BIS really appreciate the great work done by GBPN and Professor Ashok, and the current uh, revision of NBC is currently going on, and a few meetings of that have already been held. Whenever we hold that meeting for NBC Part 3, which is for development control rules and building general building regulations, then this topic can be taken up, and from NBC Part 3 itself, later on it can be taken to form the general building guidelines for state building bylaws and other policies. So this is a very great initiative, and it will be very useful in this upcoming revision of NBC 2016.
Okay.
And we would be waiting for you to share that white paper with us, so that we can also provide our feedback on this and use that for revising our national building code.
Thank you, Dheeraj. Thank you very much. And we'll be seeing you next week. Yeah.
Yes, sir.
Yes.
So we have two more questions, Ashok sir. The one is, I think this is a great initiative by GBPN and Professor Ashok Lal, as very aptly brought out during the presentation. Can we try and bring in a definition of healthy buildings in NBC?
Yeah, it seems you're absolutely right. You have to, in all regulation and standards, it is important to give a preface why they are needed and how they are arrived at. Okay. So I think the broad concept of healthy buildings does need to be put into really good technical language in the preface to the whole section on affordable housing. We shall do that. And I think that's a great suggestion. We should do that.
The next one is by Anukriti. The recommendations must also be presented to TCPO so that provisions can be included in planning guidelines for neighborhoods.
Yes, Anukriti, of course they should be. But we thought that we would first put this in sort of place at the NBC, because the NBC also has a section on, neighborhood planning and so on. And then approach TCPO, but we would like to approach TCPO through the ministry rather than directly, because we feel that it is quite important for the ministry to own the need for these improvements and changes. And therefore, under their guidance, under the ministry's, let's say, not necessarily their instructions, but they are under the ministry's recommendations to look at what the proposals are, we should be meeting the TCPO so that their scope and the purpose is well defined in national interest.
Thank you, sir. Anyone else has any other questions, they can post to the chat. And I'll also like to take this opportunity to ask Anukriti to give her feedback on the white paper, as she has experience with us in the phase 1 as well. So just a few words from you, Anukriti.
Thanks, Maz. Congratulations, sir, and the entire team, first of all. This has actually come a long way since where we started. I'm definitely very positive that it is at the right time, because PMAY is also expected to go through a major overhauling in the coming year. So yes, I hope this entire paper is able to add value to the NBC and also the policy actions that the government of India is planning in the coming future. Thank you.
Yeah, thank you. Okay, any other questions, anyone? We are almost nearing our time. Okay. So
I think, Maz, if I could just chime in for a second too. Sure. I just wanted to pick up on some of the comments there. And it really just to say that it would be good to, and as a commitment, I guess, to share the results at this point with our counterparts in Indonesia, and maybe in a broader forum looking at the impact of heat on affordable housing, because I think given the refinement of the work that's presented so far, this would be something that could be adapted, or we could compare and contrast similar kinds of frameworks with other governments in other countries that are dealing with heat in a way, and trying to avoid just simply plugging in as many fans and air conditioners as possible. So I think just as a takeaway from this one, Ashok, we'll and others on the call too who've been involved who might be interested in exchanging experiences with other experts in countries around this. Yeah. It would be good, because I do actually think there is an international program on the clean cooling initiative, right? Which is, and we've been talking with them and we know them and really respect them, but it puts the emphasis on a technical solution around cooling, and that's an energy service. But actually, if we were thinking about it from the point of view of people, we'd be thinking about it as a healthy people initiative, which is designed to try and reduce the demand for cooling through better design. And so that's something that we should probably continue to think through, whether the narrative that we would have for exchange internationally may well be much more people-centered. But yeah, leave that one with me, and I'll think about it. But any thoughts, please do share with myself, Maz, Gautam, and the team. Thank you again.
Yeah, I'm absolutely available for any discussion with other expert groups to share experiences. Yes.
Yeah, great. Maz?
Yeah. So we also have Arun Kumar sir, whom Ashok sir and myself met when we were at BIS. So Arun sir, if you can just say a few words before we close this off.
Yeah, am I audible?
Yes. Yeah.
Good afternoon and good evening to everyone present here. First of all, sorry, I had to join a little late because there was some other call from the ministry. Some meeting came up, so I had to come a little late. And we had, I should say that we had a good discussion a couple of months back when architect Ashok Lal and his team visited BIS, who mentioned about this important topic which they have taken up, particularly for the affordable housing system segment, and to ensure their well-being of that particular sector. From the BIS, as some of you must be aware, we are taking up the revision of the National Building Code of India from the 2016 edition. Now we are going to the next edition. And in this code, the committee or the BIS technical committee has also decided that considering the housing and reconstruction, which is the important area of the Indian agenda across the states in the country, we are seeing that that is the main agenda of various states. So this is the right time that we need to cater to every strata of the society. Quite a time people miss some of the major contributors. We know this hierarchy of 1 is to 2 is to 3 is to 4, typically which we see in an urban area, like from HIG onwards all the way up to EWS. And are we catering enough to EWS and LIG segment? Because there we have a lot of human population, and are we giving them the enough requirement in terms of building, and not only building, do we give them the enough social space to do all sort of other activities, and what are the documents which are necessary? So I think the project which has been taken up under this particular Professor Ashok Lal's team and the contributors from across the globe, I once again thank them for taking this important topic, which is more relevant to a society like India, where the population, of course, is racing ahead to be the #1 in the globe. And that means that we need to address much more for the existing, not only in renovation of existing housing stock, but also for the new construction. It should not be a simple building block which we make, but it should have a good connect with the people who are going to use those buildings. I believe that the step which has been taken up is in that right direction, and quite a number of useful surveys have already been conducted, and the feedback is also coming up in a positive way, that how a good connect between a human and a building can be made, and naturalization of buildings can be made instead of converting all the concrete buildings into so-called spaces. So I think this initiative deserves an applause, and more than that, we still need to do go a long way. And I believe that the final outcome, apart from the white paper which was shared earlier by the team to BIS, that would be considered by our relevant technical committees, be it on CD51 on housing and prefabrication, as well as by the National Building Code Committee. We will get it considered by the apex body on standardization, on national standardization in India, and we would try to accommodate the best in the national standards, so that henceforth all the authorities across the country would be able to start implement the project outcomes in a definite way. And if things come in the form of a national standard, it obviously, anything has got an obvious, easy to absorb or easy to assimilate sort of condition in the country. So on those lines, I believe this is the right timing that NBC revision is happening, and the project is also coming up with the recommendations. I take this opportunity to once again, I take this opportunity.
I'll be here for half a day.
Yeah, once again, I thank everyone
Enjoy Hyderabad.
for and particularly the organizers for giving us an opportunity to convey the BIS point of view also. And once again, big congratulations to the entire team for this noble cause of this important project which has been taken up. Thank you. I will stop here for now. Thank you.
Yeah, thank you. Thank you so much, Arun sir. Peter, you want to do the closing remarks?
Oh, I just think it's fantastic to hear the support that this project's getting. Clearly, it's such an important issue. It's got such a magnitude of impact. If these guidelines are implemented as been laid out, but it's also was mentioned. India's heading to be #1 in population in the world. And if you can get it right in India, it's something which is going to be globally. It's a global imperative. But if you can get it right there, I think it's a very important place to see these sorts of guidelines take traction, because of the complexity of the building market, because of the size of the building market, and because of the diversity of the diaspora and the climate zones. So when we're looking at where there is a massive growth in urbanization and urban populations it is in places which bear more resemblance from a market point of view, from a climatic point of view, and from a social point of view to India than anywhere else. So the example that you set here is really globally significant. So I would just say again, congratulate Ashok, your team. I at PH did the GBPN team and the advisory board for bringing the project to this level of crystallization. And we look forward to supporting both the international dissemination of the outcomes thus far, but also continuing to support the integration of these findings into the revisions of the Indian standards and regulations. So thanks again, everybody.
Thank you, everyone. Yeah.
Thank you. Bye-bye.
Thank you.
Bye.
Okay.
Bye.
Bye.
Bye.